Thank you so much. Very generous words. Actually, I have been really learning so much since last night. You have been an incredible host. Thank you so much, the School of Public Health here in San Antonio. It's really my pleasure to be here and my honor to be meeting you and just having this talk and this conversation with all of you. So thank you for inviting me to this your series here at the school. And it's really my honor to celebrate the new public health school in San Antonio. So thank you, Dean Vasan, Rama Shadram, for this. He's the founding dean of the new school. But of course, all his leadership team, the staff, the faculty, that's already here. Let me tell you that UT School of Public Health really was an essential addition to San Antonio. Before the creation of the school, San Antonio was the largest city in the US without a School of Public Health. So the demographics of San Antonio illustrates what the US will look like by the year 2050. Therefore, this city provides an optimal setting for educating the diverse future public health workforce that we need in Texas, in the United States, and actually in the neighboring countries as well. So it's great to know that the School of Public Health is collaborating between UT Health Science Center, San Antonio, and the University of Texas, San Antonio. Both institutions share a rich and collaborative history in meeting the unique health needs of the region's diverse population and have the federal designation as Hispanic serving institutions by the US Department of Education. Our community, ASPPH, the community that I represent, we are representing 145 accredited schools and programs of public health in the United States and in 4 countries. Welcomes our association, the UT School of Public Health in San Antonio, which aims to improve human and planetary health and well-being and eliminate health inequities locally and globally through compassion, inclusion, instruction, research, and practice. We are confident that the school's community, research, and educational partnerships will enrich San Antonio's health systems, public administration, and economic sectors. And its impact will reach the state, the nation, and of course, the region of the Americas. I'm gonna quickly review 3 points in my presentation. I'm gonna start discussing a little bit of the challenges and opportunities that we are looking in higher education right now. And then learning from COVID, a couple of just thoughts about that, and then concentrating a little bit in some of the things that we need to really re-envision when we talk about public health education. So as we all know, humanity is facing unprecedented challenges, most strikingly about climate change and loss of nature and biodiversity, as well as inequity, health, the economy, and a suite of issues related to the 2030 agenda. Given this new reality in which the future of humans, along with other species, is actually at stake, it is time for higher education institutions to systematically rethink their role in society and their critical missions and reflect on how they can serve as catalysts for a rapid, urgently needed, and fair transitions towards sustainability of the planet. The complexity of these issues at stake means that solutions should be part of a radical agenda that calls for new alliances and incentives. In 2022, UNESCO released a seminal report on transformation, on how higher education has to be transformed for global sustainability to meet the 2030 Sustainable Development Goals, the SDGs. With 2030 less than a decade away, it is paramount to think critically and act urgently to achieve the SDGs. Higher education institutions are uniquely positioned to contribute to the social, economic, and environmental transformations required to tackle the world's most pressing issues. I'm sure you all know the 17 developmental goals the world committed to reaching by 2030. And as you all know, one of the objectives is about health. But the rest of the objectives are impacted by what we do in public health, all of them. All of them are related to the social, the economic, and the political determinants that generate the conditions for populations to be healthy or ill in the first place. That's why it is critical to train the diverse public health workforce, the leaders and the practitioners and the researchers that we need in order to strategically move us to a healthier world. Transformation is the red thread running through the SDGs, which will require radical shifts in the current development paradigms, exacerbating inequalities and imperiling our shared future. The transformation depends on new knowledge, research, and competencies that only higher education institutions can provide, rooted in their historical role of service to society. More is needed to recognize the role of higher education merely. Still looking at what stands in the way of these institutions is essential to contribute significantly to a fairer, more human, democratic, inclusive, and peaceful future for all. Only a holistic approach can design adaptive and adaptable solutions. Universities must retain their position as arenas to prove ideas, give the space to test, to fail, to try again, to innovate solutions and advance research and education. They must strengthen their role to act in the global agenda by exploring and expanding the risks to societies and the natural environment, advising on remedies and engaging in societal transitions. This calls for a radically new mode of inter- and transdisciplinary action in research and education, a matrix in which new horizontal structures and platforms add to the vertical, often silo-alike structures of faculties and their departments. It also calls for much more active outreach and community engagement, as we have been talking the whole morning that you are already into it, providing science advice for policy and extended networking and alliances, while at the same time approaching society with an open attitude and a willingness for dialogue. There are several trends in higher education now, and I will just mention a couple of them that's relevant to the new school. The social trend is one of them. The COVID-19 pandemic has reshaped our lives around more online and remote modes for living, working, playing, and learning. So we have discovered the benefits of being able to do things from anywhere. Our appetite for online and remote options as consumers is likely to persist, at least to some degree. So across many institutions, the emergency remote teaching modes adopted during the pandemic, of course, that will give way to more sustainable and evidence-based hybrid and online teaching and learning models to support these longer-term consumer preferences. Expectations and demand for non-credit and non-traditional education and skills-based training are rising. Against this backdrop, students and lifelong learners will be paying closer attention to these more practical, personalized, and skills-based courses and micro-credentials as potentially more attractive opportunities for advancing their careers than the traditional college degree programs. These changes signal institutions need to realign education and business models to fit these consumer and industry trends better and to develop more attractive and flexible skills-based courses and credentialing options for educating, training, reskilling, and upskilling the current and the future workforce. Institutions' reputations and the promise of a college experience will no longer be enough to attract sustainable enrollments and funding. Their new meal ticket will be more explicit ties to the larger economy and the workforce demands. I'm sure that the UT School of Public Health San Antonio is already planning for its role in training the current workforce in Texas and beyond with lifelong training programs and opportunities. And the other thing is environmental trends. The future campus must be designed to meet more needs than ever. Campus leaders must account for new challenges, such as accommodating remote learners and workers, integrating foundational accessibility needs, and addressing new green initiatives for a sustainable campus must be designed to meet more demands than ever, for sure. The Sustainable Development Goals have impacted how the world's colleges and universities strategically plan for the campus of the future. Higher education contributes to the success of the SDGs in two areas. First, integrating SDGs into instruction, preparing students to contribute to sustainability in their personal and professional lives. And secondly, a wide variety of research conducted to faculty and students at higher education institutions directly to inform SDGs and their practical applications and how are we advancing. The SDGs call for more open and collaborative science to quickly research and solve the next generation of environmental and humanitarian crises. So climate change is becoming a central concern at many higher education institutions and professional organizations. In recent years, severe weather events, and we know that, have increasingly really disrupted daily institutional operations. So this has necessitated new approaches to mitigate the impacts of weather events on the students' lives, and of course, our learning and developing new systems that can be better endure unexpected weather events. With all of this in mind, all these trends in mind, higher education institutions must consider at least 3 areas of transformation. Number 1, they need to move towards inter- and transdisciplinary in education and research. Knowledge accumulation logic, followed by many higher education institutions, leads to overemphasizing theoretical aspects and downplaying practical issues and real-world problems, precisely those that public health aims to address. The need to include more problem-based learning and research is critical to developing our students' competencies to solve the current challenges. Number 2, the imperative need for institutions to become open, fostering really a dialogue and integrating other ways of knowing. So diverse ways of knowing can add value to strict science-based knowledge, such as experiential and practice-based knowledge, as we were talking in the morning. So universities should set an example of openness to foster dialogue, to renew our questions, and find new ways to seek answers. The demand for much stronger presence in society, in general, through proactive outreach activities and partnering with other societal actors, it's gonna be key. So I'm so happy that the School of Public Health in San Antonio is already planning for all of this to happen. So we're gonna be looking at what you are doing here as an example. So moving us to what we saw in COVID and what we learned from COVID in order to how can we move forward. So health professional educational institutions can use really the historical moment of the pandemic to rectify structural barriers and overcome limitations that the pandemic really revealed. The window of opportunity is actually fast closing. This is a teachable moment, and we need to turn the challenges into opportunities to advance and transform our health professionals' education. So we learned a lot from COVID, and I will only mention a couple of things. Number 1, our understanding of health has been challenged. Most of the health systems around the world were just concentrated on health care and not paying attention to the conditions where people live, play, and work that make them sick or healthy. And COVID just showed us once again that these very same conditions worsen in front of crises or catastrophes because the most vulnerable populations are always the ones that pay the highest consequences. So we must advance, as an example here in UT, in interprofessional education, beginning with our health professions, to include public health and well-being and social determinants of health at the front and center of all health professions education. The COVID-19 pandemic has highlighted long-standing inequities in the health system. In the US, compared with white, non-Hispanic people, minorities, in particular Hispanics, Black people, and indigenous people have experienced more than 1.5 times the case rate, 3 times the hospitalization rate, and 2 times the death rate. To fully understand the difference in health outcomes, the use and collection of accurate data, research, and health indicators regarding the conditions of all these determinants of health is needed to understand population's health while improving health community interventions. Strengthening the health system also requires a greater focus on solidarity and redistribution in social protection systems to underline structural inequalities. So despite much talk of the importance of health promotion, even across the wealthier OECD countries, barely 3% of the total health spending is devoted to prevention. And you know that this country, in the United States, actually the budget for health is 3 times higher than the next country, which is the United Kingdom. And for sure, it is the country in the whole world that spends the most, by far, in health. They say health, but it's in healthcare, right? Compared to the other countries. If you compare the outcomes of the United States, we are the number 24 outcomes. So how do you do that math? I mean, we spend the most, by far, but we have the worst health indicators if we compare ourselves with comparable countries such as the European countries or the Nordic countries. So it's because the biomedical model that we have, we don't spend enough in prevention and in promotion of the health. And of course, healthcare is very important, but also all the promotion and all the prevention that our school, Public Health School here, of course, it's gonna continue promoting and advocating for this model to really change. So single disciplines working in isolation will not be able to address complex planetary and societal challenges anymore. Academic boundaries must be transgressed by incorporating extra academic actors and knowledge into problem definition, knowledge production, and knowledge use processes. Transdisciplinary collaborations aim for both conceptual and integration of different disciplines, and the transgression of academic boundaries to include other forms of knowledge will be the future. The new generation of reforms due to COVID-19 pandemic should include transdisciplinary education to help overcome individualism. And you are in really the right place to do that here in this health center. So what does that really mean to education, to public health education? What are the things that we're looking, that we have learned and that we need to do a better job in? And let me tell you, a lot of these things, it's incredible how you have already the vision that all those things are going to be here in the new public health school. So I'm honored and congratulate this school for the vision, for the people, the leadership that are already thinking about a lot of all these things. So just concentrate a little bit in the public health school. Our profession actually started with graduate education, with the MPH and all the master's degree programs. And very soon, we understand that we need to start with undergraduate education as well, but also with the workforce that is right now in working, because the competencies are changing all the time. So if we think about these 3 circles, this is like what our schools and programs of public health around the country are doing. It's just concentrating maybe in graduate, but also starting or do collaboration efforts with undergraduate education in order to start with community colleges, undergraduate education, and then of course graduate, but very, very important, the lifelong learners to update and acquire the new competencies that we need. So data from public health wins shows that about half of all U.S. employees in state and local governmental public health, and now I'm talking about governmental public health, left their positions between 2017 and 2021, so during the pandemic. So we lost 50% of our workforce governmental public health. So this rose to 3/4 for employees aged 35 and younger, with 5 years of experience or less in 2017. Nearly 1/3 of the workforce is considering leaving in the next years. If these trends continue, by 2025, over half of the governmental public health in all states is expected to resign or retire, translating to a potential loss of 129,000 employees from the ones currently employed. So we are already adding to the already existing shortage of personnel, especially in certain areas, and will not stop impacting diversity. So rising stress and burnout and increased hostility toward public health officials undoubtedly influences these decisions to leave. While retirement is a concern, the more significant threat is the exodus of the younger employees. So the losses in critical public health experience and institutional knowledge will significantly impact a health crisis. So we need to continue advocating for substantial investment to train and support the current workforce and to train the future workforce that we need. So if you study the demographics and the data of the workforce here in Texas, you would understand the urgent need of the new School of Public Health here in San Antonio, because really our field really requires urgently all of your graduates. Now, if we look into the current, we have just a few, but if you still look at the current workforce that are working in public health, governmental public health, only 14% of those who work in public health, they have actually a degree in public health or know something about public health. So you see the tremendous need here for lifelong learning and the tremendous job of the school in San Antonio to really train all those who still remain on their job, because some of these people, or allow the people that are right now actually hiring, they don't have an idea what public health is. So we have work to do here in San Antonio and of course around the nation. And just for the future, even though we concentrate in all the way from undergraduate to the workforce, we really need to be looking at what are we doing to influence the curriculum of K to 12. Because we really, when we are hit by a pandemic as we did, we know that we really need educated citizens. And we need educated citizens, and we're gonna do that if all of us actually are trained in public health. So we need to influence also the curriculum of K to 12. So another thing that we're looking at, and that's just because the trend is incredible how much our world is changing, we really need to make a great effort of not basing our curriculums in knowledge, but in competencies. Meaning that if we used to say, all these materials, all these courses the students they need to have, so another approach to do that is just like, wait a minute, what are the competencies that they need to have? And then we put the courses. Of course, we're going to put courses, but it's just like the second part of the equation is not the first one. So the very first thing that we need to know is that what are the current and the future competencies that all our graduates need to have? And in order to do that, we need to realize a very important fact. 50% of the current jobs will disappear in the next 5 years. Let me tell you that this data that comes from evidence was done before the development of artificial intelligence. Maybe the figure is going to be even higher. So if we know that we're training the students for jobs that doesn't even exist, because that means don't worry, they're going to disappear, but they're going to be replaced by completely new jobs that we don't even imagine. So we're preparing our students for completely new jobs that we don't even know. So coming again to the competencies, what are the competencies that we need in order for the students to actually, our graduates, to go and then say, okay, now, I was studying for all these years this, and now the field disappeared, but now I have these other opportunities. What are the competencies that I can really be generalizable and I can use in different fields, in different jobs, no matter what? So we need to start looking at the essential competencies that it doesn't matter what happened in the world, I'm always going to be resilient. I always need to be to have good interpersonal skills. I always need to be agile and flexible and change. And I always need to be and more digitally and technically savvy. I need to be critical thinker. I need to be innovative thinker. So where is in our curriculum all of these competencies? How do I acquire all these competencies that are more and more important in the future? So our curriculum should look like something like this. Like it should be divided. Of course, we still need a technical and specialized material. Of course, we all need knowledge. We are in a knowledge-based society, right? So yes, there's a space for that, and that's why we're here in the university, right? But the same is important for the cognitive and metacognitive competencies, meaning the critical thinking, the ability to keep on myself studying and learning and knowing where to go for information. But the social and emotional skills, more and more, are really important. So our curriculum should include all these three areas. The other thing that it's important for school of public health, especially in their planning scenarios, is that, as I was referring before, yes, what we at a university do is degree programs, and that's of course that's going to continue. We need that. We need our master's students and we need our doctoral students. But we also need to know that there's a great need there in the workforce that are looking not for these degrees, are looking for more like agile things, micro-credentials, short online, more like mixed, learning in the community. We need to really respond to that need, and we need to value experiential learning. We're talking about this morning, and then you are already thinking about that. That's wonderful. That's exactly what we need to do. Where is that learning occurs? And if learning occurs in the community, I need to value that, and I need to account that for my experience. So we're going to see more and more of that. The other thing is that we really need to stop this conversation of, should we do everything online? Should we do nothing online? Everybody here in the university? No, nobody here in the university. And this, eternal conversation that we're always going to have the continuum. We're always going to have people, students and faculty, that will be in one extreme, and we're always going to have people, students, faculty, that are in the other extreme. So instead of like, oh no, I want to be at home alone, give me everything online. Oh no, you have to come here 5 days a week. I think that what we need to realize is that really now we have the great opportunity to embrace the benefits of both models. I think we have already learned that online education is wonderful. Of course it's wonderful. It's great to be at home and just learning. For some competencies it's perfect. And we should embrace that, and we should do more of that. But we should also realize that the social, emotional, and cognitive competencies, they're developed easier and more richer in an in-presence environment. And nobody can, say like we don't have enough evidence that the human contact is necessary to develop the social competencies. So it's not one against the other one. It's just, what are we doing now in the classroom? Of course, we're going to have more classroom in presence, but what are we doing in the classroom? We should be doing more developing the social, emotional, and cognitive competencies in the classroom and avoiding what has to be done online. So for example, those classes that, because I am of a generation that in my times, of course, I went to the university and everything was a lecture. For 50 minutes, I have to be just listening as you're listening right now to me, right? So, well, that shouldn't happen in the classroom, because all the lectures, I can videotape myself and just send it to you, and you can study that. But what happens in the classroom is more the interaction and more the development of the competencies, the team, the solving the problem, the exercises. That is what has to happen in the classroom. And then let's just use more technology at home. And just everything that they can do at home, just let them do at home. They can do great things remotely now with the technologies. So it's about more like embracing these hybrid models. And of course, I'm so happy and proud that you, of course, are thinking about, we cannot anymore think about that we're going to be a standalone institutions, standalone schools, standalone, no, this is research, that's practice. I mean, we come from a society of silo-like life, right? So it's teaching versus research, it's academia versus practice, it's medicine versus public health. No, I mean, we cannot be like that anymore. So we need to integrate models that really are more global, more practice, more partners, alliances. We need to really do more collaborative programs and practices. That's the reality. We are here to solve problems, and none of us are going to solve any problem if we are continue working alone. So let me finalize with one graphic that I always talk about this with, and I'm sure you know our great dean in BU, Sandro Galea, because we always construct this graphic and talk about this thing. So first of all, because I'm Mexican, I love soccer, of course. So I don't know how many of you play soccer, but can you tell me, who thinks that the goalkeeper is the most important player of the team? And by the way, this is your team here, right? You recognize them, right? I don't know if one of you is here, but this is the UT. Well, this is the UTSA. Sorry, the UTSA team. That's your sister institution. So just tell me, who thinks that the goalkeeper is the most important player? None of us, right? I play soccer. Well, I used to play soccer. He's a very important player, of course. It's very important. But what is his role or her role in the team? I mean, the goalkeeper is there if all of the rest of the team they didn't do their job in actually trying to put the ball there, or actually taking even a goal in the contrary. It's just to stay there. It's a defense. It's a defense, right? It's just being there, just like, okay, all of you didn't get done your job, then I need to stop the ball, right? So we need the goalkeeper. Of course, we need a goalkeeper. It's very important. But that's the last resource that the team has. Do you know who all the others are if we think about the health system? So the goalkeeper is a health care system. We need them, of course, and we need a good healthcare system, right? But the healthcare system is our last resource. So I can see all your students there, in the team, in the player, in the field, because those are the public health people that are actually doing, by their actions, preventing that people actually arrive to the healthcare. Because if they arrive to the goalkeeper, that means that person is already ill. And I don't want my people to be ill, right? I want them to be healthy. So in order to be healthy, nutrition is there, and then exercise is there, and then prevention is there, vaccines are there, and by the way, also the social determinants are there, transportation and living and work and all of that. So we have work to do in order to really start influencing the way we see the health system. It's about what we do that really maintain the people healthy, as opposed to what do we do that now that they are really ill. So just to finalize with a thought. Sometimes people always say, yeah, but what is the future? What are the future is gonna bring us? You know what? We build the future. It's not like what's gonna come. The future is gonna come with the actions that we're doing actually today. So we are responsible to building the future. So what kind of future you want? Is what are the things that we're doing now? What do we want our students to be able to do in order to have that result? So the future doesn't just happen. All of us need to build it. So thank you for that.